Thank you for joining XR Own, which is India's first AR/VR focused podcast. And today I'm delighted and honored to have with me Dr. Gao Yujia, who's a surgeon specializing in hepatobiliary and pancreatic surgery and organ transplantation at the National University Health System in Singapore. Dr. Gao's interests includes health informatics, artificial intelligence, data transformation, and medical technologies. Dr. Gao is also the Vice Chairman and Director of Science, Medicine, and Technology at the Holomedicine Association, an international association aimed at bringing together expertise from around the world to advance the science of mixed reality and its application in clinical medicine. So, Dr. Gao, really appreciate you taking time and being part of our podcast. Why don't we start with a small, brief introduction, background, and what inspired or what caught your attention to leverage XR technologies for healthcare?
Thanks, Eddie. So, first of all, very honored to be here, and thank you so much for this invitation to speak to you and also your audience about XR in healthcare. So, like you mentioned, I'm a practicing surgeon at the National University Hospital here in Singapore, and I specialize mainly in liver, pancreas, and liver transplant surgery. What really got me into the XR space was actually when I was first introduced to the Microsoft HoloLens 2. So before working, on XR, I did do projects involving artificial intelligence, mainly in big data, machine learning, training algorithms for predictive analytics. But there was one day where essentially my group CTO, Professor Nyam, he was actually invited by Microsoft to a half-day workshop, and this was, I think, in November, December 2019. And essentially that was when the HoloLens 2 was first launched. So he had an invitation to go down to Microsoft to have a look at this new device and see whether or not, there is a potential application for mixed reality technology, specifically in healthcare. So, he and I, we were just chatting along the corridor on a different project, and he sort of asked me, hey, are you free that afternoon? And I looked at my calendar. I had no clinical commitments that day, and I said, yeah, sure. Why don't I'll be happy to join at the workshop and have a look at the device and see what's what. So that's kind of how it started. And so we had that half day workshop at the Microsoft Experience Center here in Singapore. And, during the workshop, we sort of had a go at the device, played around with it, had sat down for discussions with, the engineers, the developers, and also a few other clinicians to see whether, number one, this generation of devices is, suitable for use in the medical arena. And number two, whether or not, there is actually going to be use cases for this technology. Yeah, so we get a lot of, new technology like devices, software application that gets introduced to healthcare. And a lot of times, unfortunately, they get stuck in the pilot or proof of concept phase, and they never really move on to the implementation phase because either the technology is not suitable for healthcare, or sometimes healthcare is not suitable for that technology. Right. So what we didn't want to do was to essentially have this as like a passing technology or a passing fad. And we wanted to make sure that, or wanted to find out at least whether this is something that is sustainable and whether something that we can, adopt or do in the long term. So after that half day workshop, we sort of felt that this is a technology at this stage that has some true potentials in healthcare, comparing to the previous generation devices like the HoloLens 1. This new generation of devices has a lot of additional capabilities that we felt was enough for us to start trialing in the healthcare sector. So that's kind of when we decided to do a short pilot or proof of concept to see whether, the reception on the ground with the clinicians, with the end users, is the same as what we felt during the workshop, or we were just getting a little bit ahead of ourselves. So things got a little bit delayed because of COVID. We had to put things on hold because everyone was on the ground trying to contain COVID and the damage that it's causing. So by the time we actually started our pilot, it was in August, late August, early September 2020. And for 6 months, what we did was that we acquired three devices of the HoloLens 2 from Microsoft, together with the clinical software application. It's called VSI by this German company called Epiclar. And what we did was that we went to the various clinical departments within the hospital, essentially arrange for 1 hour, 2 hour sessions with the doctors, nurses, residents on the ground, and we showed them this device and we let them play around with it. And essentially, at the end of the session, we asked them, "Do you think this is useful? Do you see an actual use or an actual application for this technology in their areas of practice? And whether or do they feel that this is just a toy that's going to be around for a while, and then we're probably going to stop using it after a couple of months?" So at the end of 6 months, we got a unanimous positive feedback from all the departments that we have engaged. We're talking about up to 30 to 40 specialists, clinicians, nurses whom we have spoken to, and they all felt that there is a real potential for this technology and its application in healthcare. So that's when in January 2021, our hospital system decided to sort of start this strategic program, which we call the Holomedicine program, which looks at the adoption, implementation, as well as the research and development into the use of XR technology in clinical applications. Right. And what we wanted to do was to not just use it for training and education, but for actual use on the ground in the operating theater, in the clinics, in the wards, actually using it to treat patients and not just for training. So
Right.
that's kind of how we started. Yeah.
So, Doctor, really appreciate you, explaining the entire journey, starting from September, August 2020, and then finally finding true potential. With mixed reality use cases in
Mm,
healthcare, both in training as well as treatment. Because I guess in a lot of these hospitals, the healthcare industry kind of tinkers around with new technology, because technology is becoming such a game changer, not just in healthcare, but across all industries. But most of the time, like you rightfully pointed out, it just stays in the pilot phase or the POC phase and doesn't go
mm,
into real implementation. So you mentioned that MR, especially the HoloLens glasses, it's showing true potential in healthcare. You also mentioned training and treatment. Can you
mm,
elaborate on that? I mean, when training and treatment, how is it being
mm,
leveraged? And why just
mm.
HoloLens? Because there's other mixed reality glasses also out there. What was
Right.
it about a HoloLens that differentiates between the other MR devices available?
Right, right. So, I mean, just a caveat and disclaimer, I am in no way trying to promote or sell HoloLens to. I have no affiliations with Microsoft or any companies out there. But the reason why we went with the HoloLens 2 was because it fit our needs requirements when we did essentially the evaluation for the different devices out there. So when we first started the program, we looked at quite a lot of different devices from a few companies. So Microsoft is one of them. We looked at Magic Leap, we looked at Sony, we looked at Epson, we looked at Lenovo, and essentially what we wanted was a device that would, number one, first of all, not compromise the safety of the patient, right? Because if we are going to use this in the clinical context, meaning that on the ground as we treat patients, before we even go and think about the benefits of this technology, we have to make sure that whatever we do, we're not going to compromise the safety of the patient. So that's number one, right? And the reason why we chose mixed reality over virtual reality is essentially because mainly because of this, right? So for virtual reality devices, or even those like nowadays with the pass through, like the Meta Quest, or even the new Apple Vision Pro that's coming out, um, the biggest downside that we see, at least for myself, and when it comes to using it to treat patients, is that you are still seeing essentially a video that's projected on a screen. right? So to us, number one is that no matter how good the camera is, it is not going to have the resolution of the human eye, right? The human eye, the resolution and the details that we pick up is a lot more, many, many times more than essentially the best camera out there on a head-mounted device, right? So number one, if we use a VR device, we're going to compromise on the image resolution, especially of the surrounding and the patients that we see irrespective of the virtual objects that's projected on it. Right, so that's number one. Number two, what we felt was that we needed a fail-safe, meaning that if, let's say, something goes wrong with the device while we're using it, it should not compromise, again, patient safety on the ground. Right? And essentially, to us, one again, the problem with virtual reality devices is that because it's a screen, if let's say something goes wrong, either you have images that are out of focus, not in the correct synchronization, or worst case scenario, you get a blank screen, right? And if let's say you're in the middle of a procedure, right, either the middle of a surgery or in the process of inserting the IV cannula into the patient, we can't afford to have a blank screen or complete blackout in front of us, right? And sometimes, some people may say, oh, you just take out the device, but it's not as simple as that. If your hands are occupied, you can't just let go of everything that you're doing and take out the device, right? So with mixed reality devices, like for example, the HoloLens 2 or the Magic Leap devices, even if let's say the device stops working halfway, right, because the visors are transparent, you do not lose your vision of everything else that's around you. Right? You will lose the information that you get from the virtual objects that's being projected, but you will not ever lose sight of what you're doing. Right? So that's one of the biggest considerations that we have as well. And the next thing is essentially situation awareness. Right? So going beyond just seeing what is in front of you, um, when we're doing procedures, especially doing operations and everything, we use actually a lot of our peripheral vision to keep track of things that's going on around us. Right. So the reason why we like the HoloLens 2 was because of the way it's constructed. It has a very open visor at the front where essentially you have no blockage of your peripheral visions on the side. There are other mixed reality devices out there that has better resolution and better, brightness, color contrast when it comes to the display compared to the HoloLens 2. But after trying out those devices, we felt that one of the limitations was that you do lose the peripheral vision because of the way the visors are constructed. So mainly because of these factors, we decided to go with the HoloLens 2 because if you look at the hardware per se, right, in terms of the compute power, the battery life, the image resolution, the brightness of the display and everything out there, HoloLens 2 is not, I would say, the leader in terms of technical specifications, right? It's heavier than a lot of the devices. It doesn't have, the best display out there. But to us, taking everything into perspective, it essentially is the most suitable device for our needs at that point in time. And even now, it kind of still fits the bill. Yeah. So, and because when we started the program, our main focus was on clinical use cases, meaning that actual use cases on the ground, and not so much our putting a main focus on training and education, right? Which is why we chose this device. Because if let's say we're just developing something purely for training and education, then virtual reality or some of the other devices might make more sense, right? Because you just need a computer generated environment. You can create your various scenarios and everything. And technically, you don't really need that exposure to the outside, right? And you don't have to worry about patient safety and those kind of things. So if it's only for training and education, then of course, a lot of the other devices out there are more suitable or more capable than HoloLens 2. Yeah, but for us, because of our considerations and the use cases that we intend to use this technology on. So that sort of led us towards favoring the HoloLens 2 over the other devices at that point.
Right, right. So, Doctor, really appreciate you again. I mean, sharing the insights. I'm sure this is going to be like great help for those budding healthcare professionals who want to leverage mixed reality and or virtual reality, and they want to make this choice. I think this would be like a really eye opener for them. Though, like you mentioned, I mean, VR, it's isolating experience, but there are like these headset companies such as Vario, VR Genius, and then Pimax, which has got 8K, 10K, resolution HMDs. But yes, it's an isolating experience, and HoloLens, I think, does stand out, in that specific areas which you mentioned about. Now, you mentioned about you using it for training, but not so much a training, but in actual treatment therapy. Could you kind of talk about or give some examples of how you have leveraged HoloLens in treatment?
Right. So one of the earliest or what we would consider lowest hanging fruits in using this technology is in surgical planning. Reason because during in surgery and in planning for surgery, we rely a lot on three-dimensional perception of the patient as well as the patient's scan. Right. So before technology like this was available, whenever we look at the for example CT scans, MRI scans on the patient, um, it's always on a computer screen where you have to use your mouse or keyboard to scroll up and down on the different cuts of the different slices. And we sort of have to perform mental gymnastics to convert those 2D images into a mental 3D picture and be able to process that mental 3D image that we created. Right. So it takes a lot of time to be able to convert that 2D image into a 3D mental picture. And of course, the more complex the organ is, the more difficult it is for us to sort of understand what we're looking at. And usually it takes a few years for a surgeon to be fully competent, to interpret a CT scan or MRI scan very well. So what this technology enabled us to do was to essentially convert all those scans directly into a 3D hologram. So instead of having to do all that processing in our brain, it allowed us to essentially, within 5-10 minutes, convert a sequence of 2D images into a 3D hologram. And in front of our eyes, we can essentially look at the patient's anatomy in 3D, like as though we're looking at the patients themselves, because the scans are from the patients, right? And what we like is that it helped to lower the learning curve a lot. And we found that, junior doctors, junior trainees, and even junior attendings and consultants are able to appreciate and understand the patient's anatomy a lot faster and in a lot more detail than if they were to just look at the screen on a two-dimensional, monitor, and it scans on a 2D monitor. So that was how we first started to use this in patient treatment, just by simply being able to plan and to look at the patient's anatomy as a 3D visual in front of you and not trying to imagine it in our heads. The next step that we went to was essentially to bring this technology into the operating theater and be able to see the scans while we're operating. Right. So, we've tried this for different specialties, including neurosurgery, liver transplant surgery, facial reconstructions, plastics, the thyroid, many. Right. And what we do is actually that so the surgeons will actually wear the HoloLens 2 during the surgery itself. And because everything is gesture control, we can actually, manipulate the images while we're operating without having the risk of breaking sterility, because we're not holding on to any external controllers or anything. And because the visors are transparent, it doesn't actually obstruct our view of the operating field. And what we do is that sometimes we actually superimpose these image or the scan or the 3D hologram onto the patient. And essentially, because the holograms are a one-to-one scale of the patient, and it's acquired from the patient themselves, we can essentially see exactly where, for example, tumors are, where the blood vessels are, and it gives you an X-ray vision of the patient itself. You can literally see through the patient and know exactly where all the different structures are. So we've used this for a lot of our surgeries to locate, for example, small tumors or important blood vessels so that we know where they are, where to take them out, where to avoid certain critical structures. And in cases where we are not superimposing the scan onto the patient, we actually put the scans in front of us as like a image reference. Because sometimes, during the surgery itself, especially for the very complex ones, um, from time to time, we do need to refer back to the scans again to reorientate ourselves to make sure that we are on the correct, operating plane. We have, the correct location of the tumors or blood vessels. And before XR technology, we would have to essentially go back to the computer, and then we have to remove our gloves or we have to have additional protection layer over ourselves to try and scroll the mouse. And there's always a risk of breaking sterility and, dirtying ourselves in that process, right? And again, scrolling up and down on a computer screen, not the best and the most intuitive way to look through the scans. So having that 3D display of all the relevant images in front of us just negates the need for us to remove our gown and gloves and go back to the computer screen and essentially having all those information literally at your fingertips. Right? And because we are able to customize the images that we see, we can do segmentations. We can isolate certain parts of the scan to show us, for example, you know, the relationship between a tumor and an important blood vessels. And sometimes what we do is that during the planning phase, we actually put annotations and drawings and notes to ourselves in that three-dimensional world. And we save it on a HoloLens. And during the surgery itself, we bring up our own notes. So we know that, this is something that I have to remember. This is something I need to remind myself as I'm doing the surgery. And it just essentially becomes what we call a co-pilot, right? It essentially, this device and this technology is our co-pilot during the surgery and is there to help us to make sure that we do things better for our patients.
Lovely. How cool is that? I mean, the future of healthcare looks super, super interesting. Through these experiences of, building real world application in the healthcare systems, is there any advice or insights that you
Hmm.
would suggest the Microsoft or other companies which are making AR, VR, MR glasses? And how do you see mixed reality evolving, in the healthcare ecosystem? Because you pointed out rightfully that these are bulky at this point in time, and it
Yeah.
still doesn't have these human eye, that resolution that we humans have. Are
Mm.
there insights that you would want to share so that they can improve to better serve, create better glasses for healthcare?
Right, right. So I think that is a tricky question to answer because there are so many factors that we have to consider, right? I mean, in an ideal world, of course, my wish would be that these companies can create healthcare specific devices, right? Because I mean, even when we first started to use the HoloLens 2, the HoloLens 2, it was never meant to be used, for example, in the operating theater to guide our surgeries and everything. So the sensors and the hardware and all those things. A lot of these devices do not have sensors or cameras that are good enough for us to reach a level of accuracy that is required in healthcare, right? So, for example, when we talk about superimposing the image on the patient, or when we talk about image registration and the accuracy of the images, in healthcare, we are looking at, deviations of plus minus 2 to 3 millimeters as our tolerance level, right? So that is kind of like the industry standard for most of the imaging navigation devices from big companies out there that we use to locate tumors inside the patient during the operation, right? But, for example, the HoloLens 2 that we use, the cameras and the sensors are just not able to give us that kind of resolution that we need because it was never meant for healthcare. Right. So of course, in an ideal world, what I would like to have and what many of my colleagues would like to have are essentially dedicated devices that are meant for healthcare, meaning that you have very high resolution cameras, you have a high resolution and very bright display, and of course, there has to be that the ability for us to further develop on the devices itself, right? But it's not that easy for companies out there that this is going to say, okay, I'm going to make a HoloLens for healthcare, right? Because they have to consider the market requirements, they have to consider R&D and everything. But I think what I've learned over the last 2 3 years working with technology like this is that healthcare the clinicians and the medical teams on the ground needs to be a part of the R&D team together with all these companies so that the next generation devices that do come out has a direct input from the healthcare sector to essentially have the technical specifications, either hardware or software, in order for us to use it in healthcare. Right. So for example, um, we actually work quite closely with Microsoft, when it comes to providing feedback and everything. And one of the things that we did tell them was that, we hope that the next generation of devices is going to have cameras that we can adjust, the infrared cameras we can adjust for the wavelength. We can, change, we can tune the amount of area that it shines on and everything so that we can essentially build upon the foundation that these companies have provided us with and create applications that are specific to healthcare, right? Because we can't really rely on this non-essentially traditional medtech companies to develop applications and use cases specific for us because they have to consider other industries as well. Right. But what we hope to have is to have a device that is flexible enough for us to carry on doing that work so that our engineers in the healthcare sector, our data scientists, our developers in the healthcare sector can take those devices out there in the market and then, adjust them, play with them, tweak with them, do further development to so that we essentially guide it towards the requirements that we need. Right. And I think that also comes down to essentially um, not every healthcare institute or not every hospital is looking at research and development, right? So I have the benefit of working in a tertiary hospital with direct links to the university, to the School of Computing, the School of Engineering. And that essentially is the reason why we can do a lot of our own research and development into, for example, building new applications and trying to squeeze everything that we can out of the devices itself. Right. But we have to think that not every hospital has the capability that we have, in terms of funding, in terms of the resources, in terms of the manpower, as well as the technical know-how to do their own R&D. Right. There will be a lot of hospitals out there that are essentially just looking for solutions that they can adopt and they can use to implement in their healthcare system. Right. So, when it comes to technology, I see that there is a spectrum of, users who just want to buy something and use it on the ground straight away, all the way to users who want to actively be involved in research and development, right? And I think in terms of the collaboration with the industry and everything, industry side essentially needs to know, right, where along this spectrum the people they are working with stands, right? Because if let's say they're going to pitch a finalized product to an institute that wants to be involved in R&D and wants to essentially push the boundaries, they're not going to get a lot of traction, right? Because I'm going to say I'm not interested in just a finalized product. I want to have the ability to modify that product and to make things better and to essentially create use cases and applications that we want to. Right. But then if they use that same tactic or that same strategy to hospital they just want to buy and essentially take a ready to go product and just use it, right? Then they have to change their strategy as well. Yeah, so I think it really depends on who they're interacting with, what is the mandate of the hospital and the institution that they're working with, what are their capabilities. And yeah, and I think that's where there has to be a very close collaboration and teamwork between the healthcare industry as well as the technology industry.
Right, right, completely fair enough. Any advice that you would like to share to aspiring medical professionals,
Mm,
hospitals, on how they should go about if they want to leverage these tools for healthcare?
right. So I think what I would say is that don't be afraid to try and don't be afraid to give technology a chance, right? Because I mean, for us, when we first started this program, we had no reference, right? Because no one else has used it before. There's no literature on this, there's no evidence on this. There isn't anything out there to say that there's going to be benefits in adopting this technology, right? But to us, what we did was that we saw the potential. We said that let's give it a try. We knew very well that it might be a complete failure. Right? We could have spent, 1, 2 years going into it, and essentially at the end of the day, no one uses it. And, it could have gone very much the other way as well. Right. So I think having that open mind and having that mindset to want to try new things, to keep thinking about, how do I improve the way I do things now? I think that is essentially the first step and the first important question when it comes to integrating healthcare and technology. And because if let's say we don't think about it, and we don't want to try it, it's never going to come in.
Right, right. Yeah. And the world is moving so fast, and technology, I think,
Yes.
is playing such a huge role. It's seeping into each and every aspects of a life. And I think all
Mm,
industries, whether it's healthcare or any other industries, needs to look into it and start understanding and tinkering it around with it, because it is becoming the future. Any peers who are taking the right approach of leveraging mixed reality technologies for
mm,
healthcare, if you that would be great if you could talk
mm.
about that. And what are the other emerging technologies you see or trends that you believe will play a significant role in shaping the future of healthcare?
Right, right. So I think right now there are many hospitals and healthcare institutes around the world that's using XR technology. I mean, when we first started, it was only a handful, but I think over the last 2 to 3 years, as the XR technology becomes more and more prominent in healthcare, as there are more success cases out there of people trying it and getting it to work. Right now, I think there are essentially hospitals in every continent in the world that's using XR technology. Some of them are using it in a small scale, just trying out first and see how it goes. Some of the other hospitals are essentially, creating full-scale programs like what we have in NUHS, in adopting this technology. Yeah, so I think the acceptance of XR technology in healthcare beyond training and education is definitely gaining more and more traction over the last couple of years. And as the technology matures, I'm pretty sure this is something that's going to be here to stay. Right. I mean, and to on to your second question, what are the other things that are coming up? There's many. There's so many things out there that we can potentially look at that I don't think I can or I'm able to mention all of it. But some of the things that we are working on now in my hospital is essentially building up that integrated network infrastructure that we feel is necessary in order for us to carry on doing what we do, right? Because when we look at AI in healthcare, we see a lot of talk and we see a lot of coverage on, for example, XR technology, machine learning, large language modeling, predictive analytics, image analysis, and stuff like that, right? But to to us, what we see it is that these are essentially front-end applications, right? These are things on the ground that gives you the information that you need, that you're using it in the front lines in a way. Um, but what we came to realize was that in order for us to make sure that all these front-end applications work smoothly, we need a very robust back-end infrastructure, right? Because without that robust infrastructure, it doesn't matter how good the front end is, you're never actually going to be able to scale it. We're never going to be able to bring it to production level. Right. So in parallel with all this front end applications that we're doing here in NUHS, we actually spend a lot of time developing our backend infrastructure, which is our AI network. So right now in our hospital, we have, I would say, one of the more comprehensive AI networks that's out there. And essentially, we have our own on-premise AI servers. One is for research. The other server essentially has a real-time communication with our electronic medical record systems. We use Epic here in NEHS. And the research server allows us to do a lot of our large data modeling, machine learning modeling, large scale data analysis, and building all those algorithms that we need for the front end systems. And the second layer, second AI system called Endeavor AI, is where we have this algorithms that we have trained to interact with real patients' data in real time. Right. And essentially, this allows us to integrate data coming from multiple sources into a single area to make sense of all the billions of data points that's coming in every day from around the different hospitals within our hospital cluster system. Right. And the next thing that essentially we went into was 5G, because right now, a lot of our medical devices are going wireless, right? Be it the HoloLens 2, be it, patient monitors, or even those wearable sensors that patients have, right? So in the future, we're going to have a lot of data that's going to be coming in from wireless devices, right? So one of the biggest problems that I'm sure you know as well when it comes to wireless connectivity is the bandwidth and the speed of the connection. Right. So in my hospital, we have Wi-Fi 5. I mean, on a good day, we can get reasonable data transmission speeds. But if let's say, we are to have a very high bandwidth, low latency network, which is essential for all these front applications to work. Because let's say, for example, the HoloLens 2, right? We are collecting a lot of real-time images and real-time data from the cameras on the HoloLens 2 and processing them in real time, and then, giving an output to the clinician that's using it. Right. So we need a very good wireless connection, a secured wireless connection, as well as a very good compute, either the cloud compute or edge computers, in order for us to do all this, high requirement processings in real time. Because if let's say there's a lag, there's a latency, then you can't really use it on the ground. Right. So 5G technology essentially to us is that the bridge of the gap between the front end devices and our back end infra system, and enabling us to have a very secure high speed network. We've done speed tests on the ground comparing Wi-Fi, 4G, and 5G, and we are getting transmission speeds of, up to 10 times more on the 5G network. Right. And so that's kind of the reason why in NUHS, we have sort of deployed our own indoor 5G network, an enterprise 5G network, and we have our own dedicated radio dots and radio antennas in the operating theaters, primarily to support all this wireless data transmission we know is gonna come, and we're just essentially trying to lay the groundwork and lay the infrastructure for hopefully the next few years. Yeah.
Wow, how cool is that? I mean, you guys are fundamentally building the foundational model of what the future of healthcare is going to look like with all of these tech stack converging, right from XR to 5G to AI. I think when all of these converges, you will have with all the data that's been collected, I think we'll be able to completely upend how the healthcare is being done. Kudos to you and your team,
Thank
Doctor.
you.
Really appreciate you taking time and being part of the podcast. My last question to you: would you be able to paint a picture of what the world is going to look like in the next 10 years when all of these things that you mentioned, how's the healthcare going to look like?
Right. I mean, what I would like to see is essentially the integration of the different silos in healthcare into an ecosystem, right? Where the moment the patient enters a clinic or the patient enters a hospital, their information, their data is already integrated into the entire hospital system, right? And you won't end up having problems where you have difficulty getting data from one place to another, or you have difficulty, getting information on the patient, right? I mean, I'm not sure where, in 10 years' time, are we going to see everyone walking around with a AR or XR device, pressing in the midair when it comes to, their user interface and everything. It might be, right? We are already moving towards that stage. But I think what's most important to me is that regardless of what the front end systems that we use, be it XR or just laptops, traditional computers and everything, what I would hope to see, or what I think should happen in the next 10 years, is really the creation of that ecosystem and the integrated data network to allow this ecosystem to exist. And no longer having things in healthcare being siloed and systems not talking to each other. I think that's kind of what 10 years from now, I would want to or hope to see.
Lovely. How cool is that? Because I guess the problem with the world today is a centralized functioning. Everything is so siloed.
Yes.
Eventually, hopefully, we get into a world which is more decentralized, and the data starts having meaning, and there's an ecosystem where you are not you 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 know what you want and you get it at the tip of your this thing. So I hope the vision comes true. Really appreciate you taking time and being
Me
part of
too.
the podcast. And to my listeners, if you like what you see in here, then please press the subscribe button. Until next time, see you guys. Bye. Thank you, Doctor. Really appreciate it.
To locate you. Thank you. Thank you, Eddie. Thank you.